What if a new drug combo could finally help patients with the toughest breast cancer? Welcome to Science My Health, your channel for health and research information. Triple negative breast cancer, or TNBC, is one of the most aggressive forms of breast cancer. It's called triple negative because the cancer cells lack three common receptors: estrogen, progesterone, and HER2 that some other breast cancers have. That matters because most targeted therapies work by attaching to one of those receptors. Without them, TNBC doesn't respond to hormone therapy or HER2 targeted drugs, so doctors often rely on chemotherapy first. TNBC accounts for about 15 to 20% of breast cancer cases and is especially hard to treat once it spreads. The latest research comes from a major Phase 3 clinical trial. This study, published in the New England Journal of Medicine, tested a new combination of two cancer drugs, sacituzumab govitecan and pembrolizumab, as the first treatment for patients with PD-L1 positive advanced TNBC. PD-L1 is a protein on some cancer cells that interacts with the immune system. When the tumor makes a lot of PD-L1, it can hide from immune attack. This trial focused on patients whose tumors had high PD-L1 expression, meaning they were more likely to respond to immunotherapy. So how do these drugs work? Sacituzumab govitecan, sold as Trodelvy, is a type of targeted therapy called an antibody-drug conjugate. It acts like a guided missile. The antibody part finds cancer cells that have a protein called TROP2 on them, and the drug it's carrying kills those cells once it gets inside. Pembrolizumab, also known as Keytruda, is an immunotherapy drug that helps the immune system notice and attack cancer cells by blocking a "don't attack me" signal. When used together, these drugs aim to both directly kill cancer cells and help the immune system join the fight. In the trial, 443 patients took part. People with previously untreated PD-L1 positive advanced or metastatic TNBC were randomly assigned to get either sacituzumab govitecan plus pembrolizumab or standard chemotherapy plus pembrolizumab. The goal was to see how long patients lived without their cancer getting worse, a measure called progression-free survival. The results were clear. The combination worked better. Patients receiving sacituzumab govitecan with pembrolizumab lived a median of about 11.2 months before their disease progressed. Those receiving chemotherapy plus pembrolizumab lived about 7.8 months before disease progression. That's roughly 4 more months before the cancer got worse in the group taking the new drug combo. Early signs also suggest a trend toward longer overall survival, although more time and follow-up are needed to confirm that fully. Why this matters for patients and doctors. Until now, the standard first-line treatment for PD-L1 positive metastatic TNBC has been chemotherapy plus immunotherapy. While that has helped some patients, many still saw their disease progress relatively quickly. This new combination is one of the first to show that using a targeted antibody-drug conjugate together with immunotherapy can significantly improve how long patients live without disease progression in this aggressive cancer. This study isn't just about numbers, it could change care. Experts believe these findings could support sacituzumab govitecan plus pembrolizumab as a new first-line treatment option for PD-L1 positive TNBC. For patients, this means a therapy that keeps the cancer under control longer than the current standard may soon be available, offering more time and potentially better quality of life. Here's what this means in real terms. Every patient's situation is different, and treatment choices should always be made with a healthcare team. But for people whose TNBC tests positive for PD-L1, this combination could offer a meaningful advantage: a longer period before the cancer grows or spreads further. It also highlights a growing trend in cancer care, combining therapies that attack the tumor directly with treatments that help the immune system join the fight. The bottom line, for patients with PD-L1 positive advanced triple-negative breast cancer, sacituzumab govitecan plus pembrolizumab has shown improved cancer control compared with standard chemotherapy and immunotherapy, and in the future may become a new first-line option based on these research results. Like this video if you learned something new, and subscribe to Science My Health for more health research news.